69.2% of adults living with diabetes in Africa are unaware of their condition. That's according to a survey conducted by the International Diabetes Federation in 2017. The statistics is worrying because though there is no cure for diabetes, the condition can be managed if detected early. As part of efforts to raise awareness of the disease, the Diabetic Endocrine Metabolic Society of Ghana organized a free screening session for traders at the Nima market. Dr. Josephine Akpalu, an endocrinologist, revealed out of the 40 people they screened, 15 of them had worrying sugar levels.
In Ghana, we don't have a nationwide survey that will tell us the exact numbers, but we've had some community surveys which have been done in the population by some of our professors. And one of them that quickly comes to mind is one that was done by our professor, Prof. Amwa, and it showed that about 6.8% of the population, general population, had diabetes. And that was done almost 10 years ago. So currently, I believe that the levels will be much higher. With those who have diabetes, we can say that about 6.8% of them may have diabetes. In the whole world, if we use as a federation, we call International Diabetes Federation, they have done worldwide surveys and noticed that generally in the whole world, for every one diabetic patient that we have, there's another one in the community who has it but doesn't know. But when it comes to Africa, for every one person who has diabetes, there are 2 more people in the community who have it and are not aware. So these are ways in which screening is a way in which we can identify those people who don't know that they have diabetes, because it's one of the conditions that when you pick it up early and you control it, it prevents you from having the sequelae or the complications that we are so much afraid of.
A beneficiary sharing her experience charged parents to cut down on carbohydrates when cooking for their children. Away from that, I was still on diabetes, I must say. Did you know that the cost of insulin injection and daily monitoring can consume as much as half of a family's average disposable income? Well, what about a patient whose families in severe cases are unable to afford or even access basic necessities to fight the diabetes? Here are some proposed solutions which are prevention, support and taxation. As we commemorate World Diabetes Day, we're shedding light on how best families can manage the increasing spate of cases and the role of the bigger family, the government.
Diabetes is a group of metabolic disorders in which there are high blood sugar levels over a prolonged period. Symptoms include unintended weight loss, increased urination, increased thirst, and increased hunger. In Ghana alone, over 8,300 people died of the disease in 2013 and another 5,000 in 2015. The theme for this year's World Diabetes Day, the family and diabetes, has brought to the fore the need to create a support system for those affected by diabetes. According to Deputy Head of Care at Diabetes UK, Douglas 24, a very strong family foundation is an essential step in improving the health of such patients.
Because we are not doing we are doing almost nothing, which for me is not an option. So for example, if somebody has type 1 diabetes, how they manage their diabetes is that every time that they are going to eat, for example, they are going to eat fufu, they have to count how much carbohydrate is in the fufu. That's a huge task. For me, the theme for this year's Diabetes Week is that we are going to raise awareness of diabetes first. And the reason for that is, if you have a family member who has diabetes, your risk of developing diabetes increases.
According to the International Diabetes Federation, an estimated 382 million people have diabetes worldwide, with projections to 300 million by 2025, with majority of this increase to come from developing countries. While Ghana's health ministry has taken certain steps to tackle the disease, the specialist dietitian believes the efforts should be channeled at preventive measures.
First of all, the government has to make some resources available to raise awareness of type 2 diabetes, but also think of some policies to help people live healthier lives. Without insulin, people with type 1 have about a few weeks, months maximum to live.
So as we commemorate the World Diabetes Day, the responsibility of a family remains essential in curbing the disease. Kenneth Awatre Darko's report for Joy News.